246-4237. You can call during the week, ask your questions, come in, and it's really best to come in, sit down, close the door, stay a while, and find out what's going on and what your options are, whether it's prostate cancer, breast cancer, or recurrent cancer, where your treatment just isn't doing the right thing. It's not working. It's not tolerated. Give us a call at 212-CHOICES, which is 212-246-4237. Hey, we have some good news. We actually have a lot of good news. This gentleman I just saw yesterday, it's a gentleman who's an Italian-born man, married his parents' nurse, a Filipino woman. He presented to us with esophageal cancer. He actually had chemo and radiation elsewhere. The cancer came back. The cancer blocked his esophagus, so he couldn't eat. And his doctors had no solution for him. He lost a lot of weight. The food got stuck. He couldn't eat. He was really suffering. He has a niece who's a nurse, and that niece was deeply involved in having him come to us because she knew a second opinion was a good idea. He came. He talked it over with his family, his wife and family members, and he decided to have radiosurgery for esophageal cancer that was blocking his esophagus. So, how does it work? Well, radiosurgery will make a stereotactic frame. It's all custom-made, non-invasive, no cutting, no bleeding, no pain, no hospital stay, no anesthesia, nothing like chemo, where the chemo goes throughout the body, nothing like surgery, where the knife goes in your body, none of that. 5 treatments. Each treatment's 15 minutes. Came to us from Long Island, came on the Long Island Railroad, came right to Penn Station, walked over to our office, which is just a few minutes away, which is one reason why I say it's not only super convenient, but it is pretty super convenient. He had his 5th treatment yesterday, and he's eating. Yes, after 5 non-invasive treatments, radiosurgery, he's eating. The food's going down. It's not getting stuck. And now he's coming back next week because he wants other areas treated with radiosurgery. So what's our success rate where we aim the beam with 5 treatments for radiosurgery for esophageal cancer to stop the cancer where we attack or shrink it or even make it go away with time? Well, it's about 90%. So it's very effective for most people. It's not perfect, but it's very effective for most people. Non-invasive treatment. For this gentleman, it's truly the good news day. He was happy, his wife was happy, and I was happy too. I'm happy when our treatment works, and that's why I'm usually happy, because our treatment usually works. And that's why our patients are usually happy, because our treatment works, non-invasively. Hey, there's another report out here about robotic surgery for prostate cancer. Well, we've been talking about robotic surgery all year. A lot of people like to go around and say, I had the robot. Well, what is a robot? Well, a robot, it's a machine with your doctor, the surgeon, sitting in the next room, moving his hands around, looking in a video scope, trying to move the hands, the mechanical hands, from his own hands, not touching you. Ugh, I have to touch the patient. Ugh. Well, maybe it's better. Nobody cuts on the patient, not the surgeon, not the robot, nobody. Why? Because there's an analysis done. Supposedly the robot is better because it has super eyes and super blades, but the actual data now shows it's no better than open surgery, and it costs a heck of a lot more because of all this disposable stuff, which it's like getting a printer from XYZ company. You can buy the printer for cheap, and then you have to buy all the ink. Well, the same with robotic surgery. It costs more because, first of all, the hospital has to spend millions of dollars, and then they have to buy all the disposable equipment, which costs oodles, and guess who pays for that? You do. Yeah, you do. Whether it's your copay or your insurance, yeah, you pay for that. And you're paying for something that you think is better, right? You hope, right? Well, there's more and more and more and more data showing that robotic surgery is not better. And I'll show you data where we have better results. For example, Gleason 7 cancer, a patient comes to us, 90% success rate. Success rate with surgery, the best surgery in the best hands, about 60%. We're 50% better for prostate cancer with our radiosurgery frame treatment and brachytherapy than open surgery or robotic surgery. But let's just talk about this robotic surgery for a moment. There's a new report this week that analyzed 6,000 men going through prostatectomy. Now, I know you believe the complication rate should be less because they've got the super arms and super beams and super booper duper. Well, actually, the complication rate didn't change between men who had robotic surgery and those who had open surgery. Hey, well, why are you being told that robotic surgery is better? Well, the complication rate's no better. The survival rate's no better. Oh, the hospital rate is better. Yeah, they get reimbursed more. Well, I guess that's good for them. Is that good for you? I don't think so. So robotic surgery has become the dominant surgical technique for men with localized prostate cancer. And many men have chosen robotic surgery, increased the rates of radical surgery to much higher levels than they were before. Now, the one point of agreement is higher costs, and that's the disposable materials and maintenance of a multi-million-dollar machine. So researchers looked at data from October 2008 to December 2009. They used Medicare data. They evaluated 5,900 patients with prostate cancer. About half had robotic, about half had open. The complication rate was no different. Now, by the way, we reported a couple of weeks ago that readmission, how many men get readmitted after prostatectomy for complications? Well, it's about 10% in both groups. So just because they have the super-duper robot doesn't mean they don't have complications. And in fact, the vast majority of men report significant problems with their sexual life, which means erections not adequate for intercourse, and with their urinary life, which means leaking of urine. Talking about spending more money, and no better data showing improved survival. As we said before, for example, Gleason 7 cancer, which is not an unusual stage of cancer, type of cancer, 60% with surgery, 90% with us. If you could avoid the cutting, the bleeding, the radical surgery, the robot hands in your body, wouldn't you do that? Especially if you could get a better result non-invasively? Just makes sense. So look at the data. We actually have a booklet on prostate cancer, and it goes through this data. You can see surgical results from the best people in New York and Baltimore and Boston and Philadelphia. And then our data right next door compared for the same risk factors, the same period of time. What's our data and the surgical data and even other radiation data? And when you see that, you'll want to beat a path over to radiosurgery and have a discussion and a consultation with our doctors, even me. I'd be happy to meet with you. As my grandfather said 50 years ago, sit down with the doctor, close the door, and stay a while. Don't be in a rush. You answer the questions. We ask questions. You ask questions. You get copies of your data. Do you have a copy of your biopsy and CAT scan and bone scan and PET scan? No? Well, you should. So that's the kind of difference at Radiosurgery New York when you come and see us compared to all the other stuff. We show you the data. We show you the pathology. We show you the tests. And you read it yourself. No secrets here. Doesn't it only make sense? So, we're going to stop for just a moment. We're taking your calls. We're at 800-848-9222, which is the WABC studio. We're live. We're also at 212 Choices, which is our office number, and you can call during the week for that free booklet and DVD. We're going to hear a few new voices. We'll be back in a moment. And bundle up. We're ready to move on. Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
You know, you're sitting around at the Seder table, Passover, last night, tonight, and you see a lot of people you haven't seen in a month of Sundays. Make that Saturdays for Jews, right? And then all of a sudden the guy's telling you, oh, my chemo and the other cancer. It always comes up, medical conditions. And likewise for the Gentiles on Easter Sunday, you're going to be discussing all kinds of medical issues. And a lot of times the big C, cancer. Well, look, if you have newly diagnosed and recurring cancers, you need to go to the best, not like the rest. And I don't want to hear that your doctor is the best. Dr. Gil Lederman, he's dealt with it all. He's dealt with it all. And if you've had prior chemo and radiation and surgery that didn't get the desired results, why wouldn't you want to set up a sit-down meeting with Dr. Gil Lederman, right? If you believe in the resurrection and Easter, another opportunity, right, and living a better life. For Passover, actually Yom Kippur, I think, right? You get written into the book of life. You want to stay in the book of life. I think. But Dr. Gil Lederman gives you that shot from a medical perspective because when it comes to cancer, all kinds of cancers, he knows how to deal with it. He's been dealing with it ever since he brought stereotactic body radiosurgery to America. So call Dr. Lederman at 212-CHOICES. That's 212-CHOICES. You talk to him, he sends you an informative booklet, DVD, and then you have a sit-down at his office at 38th and Broadway. He takes most insurances, Medicare and Medicaid. Just call Dr. Gil Lederman for your cancer treatment choices at 212-CHOICES. That's 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back. We're back taking your calls. Feel free to give us a ring-a-ding-ding. We're at 800-848-9222. We're live. Hey, there's another report that was out this week about that robot. I told you about the robot. The success is less than stellar. Less than stellar. Well, it's not only me saying it. There's a report out showing that their profits of Intuit, the company that makes robots is called Intuit, their profits dropped 77%. There was a steep decline in the sales of robotic surgery. So if someone's telling you about how great it is, look in the newspaper, look in the Dow Jones, look at the Wall Street Journal this week, a 77% decline. Why? Because it ain't as good as you might be being told. And people are getting nervous. They don't want to spend millions of dollars on a machine that doesn't give better results. Yeah, of course, we all want better results. That's why we publish our data. When you open up our book, you see our data. Does robots show you their data? No, because the vast majority of men who have robotic surgery have sexual problems and urinary problems, and then after that, recurrence of cancer problems. So look at the data before you make a decision. Robots sound sexy, but other people call it puppet therapy, and the puppet is not doing so well. Profit down 77%. People are staying away, and they're staying away for a good reason.